Hi, welcome to the Avaaz Health Podcast. I'm Roop and joined with Dr. Madhu and Dr. Jiti. And today we're going to be revisiting some of these questions that we get. We get questions all the time on our social media, and we want to bust some of those myths because some of the things that you've been hearing on various social media platforms are just not true. So we'll ask the questions and our doctors will answer the questions, and let's get down to it. The first myth is more testing is better testing.
Well, a lot of people feel that more testing is better care, but I'm here to tell you that's not true. So when you come into the doctor's office, the most important thing for a physician to do is get your history, listen to your story, then do a physical. And if we need to order tests, we will definitely order the appropriate tests. But once you start doing too many tests, you have the side effects of the test. Certain tests lead to other procedures, and those procedures have complications, and we're not really doing you a service. We're creating more anxiety. Sometimes you can get false positives. So a test that we order because we're anxious can be falsely positive. That leads to more things. You can do unnecessary biopsies, unnecessary procedures. Some people would want what we do is a CT scan with a dye. Well, that dye can injure your kidneys. So really, when we do tests, please don't think that we're not trying to listen to or listening to you, and we're trying to keep you safe and not harming you. So we want to do the tests, but we want to do the tests that are appropriate. And unnecessary tests lead to higher costs, lead to longer wait times, a strain on the resource. So what's better care? Better care is evidence-based testing. So we want to listen to you. We want to listen to the symptoms. Obviously, we want to share in the decision-making process, but the most important thing I can tell you, if you're worried about things, please get the appropriate cancer screenings done.
Correct. And so just because one doctor has denied you certain tests does not mean you go doctor shopping to get tests again. So follow your primary healthcare physician's advice. Dr. Jiti, why would somebody need to get cancer screening if they don't have any of the cancer symptoms?
Well, it's a very good question, Roop. I can't emphasize this enough, but cancer screening saves lives by detecting cancer at earlier, more treatable stages before symptoms begin. The fundamental goal of screening is to reduce cancer mortality by treating the cancer when treatment is most effective. And in some cases, it can even prevent cancer by identifying and removing precancerous lesions. Screening has been proven to reduce mortality from many cancers, including breast, cervical, colorectal, lung, and prostate cancer, and that's in individuals who don't have any symptoms. And in fact, for colorectal and cervical cancers, you can actually prevent cancer by identifying it at an earlier stage and removing it before it has a chance to become a cancer. Now, age-adjusted mortality rates for cancers have decreased significantly since we started these screening programs. And individuals that have their cancer detected through screening have earlier stage diagnoses, and there's shorter intervals to the time of diagnosis, and that's what reduces the cancer deaths. In a particular large study that was done, screened patients had significantly lower rates of stage 4 cancer diagnoses. And for those who don't know what stage 4 is when it's spread beyond where it started. And often it's in organ systems. And at that point, it's too far advanced to be curable. So in this study, they showed that stage 4 cancer was much more common in patients who did not have screening. So for breast cancer, 10% of patients who did not have screening had stage 4 disease versus those that were screened, it was only 2%. And for colorectal cancer, the ones that weren't screened, they had 27% stage 4 disease versus only 16% in those that were screened. So there's a big difference there. Treatment is generally more effective when cancer is found at earlier stages, before it's gotten a chance to spread either regionally or distantly to other organs. So cancer screening saves lives, people. And you do not wait until symptoms occur to get cancer screening done. We know it saves lives. You should get it done when it's available and according to what your family doctor is recommending to you.
So when you get that letter or that note to get your mammogram, please schedule your mammogram and get it done. Yeah. Dr. Madhu, this is something that we heard. I'm a young male, healthy, but I want to get my testosterone checked.
It's the bane of my existence in my practice. I get so tired of hearing it. They'll come in, I'm feeling low energy. I want my T checked. I'm like, ah. So I hear this a few times a week, and I just look at them, and I've known these guys since they're babies, so I just roll my eyes. I'm like, come on. They go, no, 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 it's due to low energy. So I don't know where this information is coming from, but I am here to bust this myth. So I hear it comes from fitness influencers, people getting the messaging from TikTok to optimize your hormones. If you're tired, blame it on low T meaning testosterone. They have erectile dysfunction anxiety. There's a lot of online testosterone replacement therapy clinics now. And so there is a perception that if my testosterone's not at this certain level, then it's not good enough. And that they're looking at doing things like TRT, testosterone replacement therapy. So first of all, let me tell you, testosterone is not constant. It varies. And just because someone tested it might be on the lower end of normal does not mean that you're abnormal. That is completely normal. It's not a pathology. We don't do anything about it. It varies depending on the time of day, depending on your stress level, depending on sleep, depending on calorie intake, all those different things. So there's no optimal. So when do we test people? Honestly, we test people when there are actual true symptoms. And those would be things like infertility, or there's physical changes with your genitourinary organs, maybe sexual dysfunction, but they have to be very specific. It's extremely uncommon. I have honestly, knock on wood, yet to see it in my practice of 30 years. So when you have things like I said, infertility, the loss of hair, maybe gynecomastia, things like that, okay, we'll check it out, but not because you're feeling tired. No. So no. And honestly, look at your sleep, look at your stress level, look at your nicotine intake, stop using pot, don't drink too much. Fix those things first, then we'll talk. That's where I'm at.
Sounds like a great checklist.
I'm done.
So on the other side of that coin, do healthy young women need to get their hormones checked? Big sigh means
The short answer is no. However, there are cases where, yes, we do need to check it out for sure. But again, I cannot emphasize this enough. You are the patient. We are there as doctors to listen to your story. Please make sure you're telling the story. Please make sure your doctor's asking the questions. Getting these tests done usually are, honestly, it doesn't help. So your symptoms matter. We have to talk about your cycle. Let's talk about other issues, your menstrual cycles, what I'm talking about for women. We have to talk about other things. Just to check it, just to see where your hormones are at, is not working. Your hormones, again, fluctuate daily, weekly, hourly. It's of no proven benefit. When are tests appropriate are when we have symptoms that we go sort of ding some alarm bells, like, maybe we should investigate this a bit more. So very painful, maybe irregular absent periods. You're just not getting periods for maybe 5 or 6 months. If we're looking at the signs and symptoms of PCOS, where you might have hair loss, severe acne, excess hair growth, again, infertility. We might check things when there's galactorrhea, which is milky discharge from your nipples, early menopause, late puberty, those kind of things. So honestly, the bottom line is this: no symptoms, regular periods, probably don't need your hormones checked. Symptoms, cycle changes, targeted checking of hormones based on what your doctor decides after talking to you. That will help you out more than anything.
So, Dr. Jiti, I'm so glad you're here with us today because you are an oncologist. You specialize in cancer care. So, this cancer question is for you. If somebody has a pain in their breast, does that mean they have breast cancer?
This is actually a very common misperception about cancer. Breast pain is rarely a sign of breast cancer. In fact, in one study that looked at over 600 women, that had isolated breast pain, only 1.8% ended up getting diagnosed with breast cancer. And in women who have been diagnosed with breast cancer, only about 6% present with breast pain as their only symptom. Breast pain is actually one of the most common breast symptoms that women in their reproductive age can experience in their lifetime. About 2/3 will have breast pain at some point in their life, but that doesn't mean they have breast cancer. The vast majority of breast pain is benign, and it's associated with hormonal changes, with your menstrual cycle, with certain types of medications such as birth control pills, with fibrocystic changes in your breasts or cysts, or just aches and pains having to do with your muscles or your rib cage. However, saying all that, if you have breast pain and this breast pain has been present for a significant duration of time, say 4 to 6 weeks, then it's still worthwhile making an appointment with your primary care provider and going in and getting a history and a physical exam done, because they're looking for certain things that are going to trigger them to do additional testing. So if the pain is focal, meaning that it's specifically in one area of the breast, that's more of an indication to get further testing, such as mammography or ultrasound. But if the pain is in both breasts, or if it's cyclical, then likely it's not anything to be too concerned about, and the patient can be reassured, and that opportunity can be used by the primary care provider to remind the patient to make sure that they're up to date in getting their screening mammographies as well. And when we do look at breast cancer, the most common symptoms actually is a mass that's painless. So not associated with any pain in your breast or under your arm, or maybe some change in the contour or some nodularity in the breast that's not present in the other breast, or changes in the skin of the breast, or discharge or pain or changes around the nipple. Those are more common symptoms of breast cancer.
When I had breast cancer in my early 30s, the first symptom I had was a hard mass, right? So that, was obvious. There was no pain at that. I didn't feel it, and that now goes to, this is actually a fear I had at the time. If I do a mammogram, the radiation will increase in my body, and am I going to increase my risk of somehow making this cancer go faster or another cancer developing? But so the fear of mammograms should not, or the fear of radiation should not stop you from doing a mammogram, correct?
That's right, Rup. The risk of radiation making the problem worse is minimal. And there are lots of reasons why women are reluctant to get mammograms in addition to the radiation risk. Some women don't like the idea of having their breasts compressed in the mammography machine and the pain and discomfort associated with that. Or maybe the friends have told them that, it's really painful. But you got to keep in mind, people's pain tolerances varies quite a bit. And it is momentary. Like the compression doesn't, it's
like
several seconds. That shouldn't be a reason not to get mammography done. The other reason people don't get mammography is logistical concerns. I don't have the time. I can't take time off work. I can't schedule. I'm just a busy mom and I've got a job. Or in certain countries outside of Canada, cost, because screening is not covered in all countries. Fortunately, in Canada, it is, as long as you meet the guidelines. And then the other thing that people don't go in for is because they're fearful or they're anxious about getting an abnormal result or actually having breast cancer. But you have to, in your mind, going back to that screening question, it's much better to find this through screening at an early stage so that you're more successful in treatment and can reduce the amount of treatment you might get and the actual risk of the cancer in the long term. And then the other thing that people worry about is false positives. So when the mammogram comes back saying that there's something there, but it ends up not actually being cancer. And that does happen, and sometimes additional testing is required, but that is in the minority of cases. And then going back to your original question, which was, what about radiation risk? The amount of radiation associated with the mammogram is quite minimal. And when you look at the mortality benefit from early screening compared to whatever radiation risk, there's about a 25 to 100-fold benefit in getting your cancer detected through screening than any risk associated with radiation. And that risk decreases with the radiation risk decreases as you age and with screening frequency as well. So for instance, in women, if you screen women every year between the ages of 40 to 80, theoretically, that could result in 20 to 25 cancer deaths per 100,000 women. But if you screen women every 2 years from the ages of 50 to 59, that's only associated with 2 deaths related to radiation amongst 100,000 women. And to put it into perspective, that radiation risk is comparable to what we all experience with background radiation in our environments over several months. It is minimal, ladies. Please get your mammography. And in BC, the screening guidelines are between the ages of 50 and 74 every 2 years. And you can start at the age of 40, but speaking to your family doctor about the risks and benefits in those ages. And then, of course, people who have a history of breast cancer, a family history of breast cancer, often need more frequent and earlier screening. And that, again, they can discuss with their primary care provider.
So higher risk of not having your mammogram than having your mammogram.
Absolutely.
Yeah.
Go get your mammogram.
Go get your mammogram. So the next myth is cortisol. I am so tired. I don't have the energy to wake up. I have a meal. I want to go to sleep. I don't have the energy to run around, take my kid to soccer. Can you help me with my cortisol, Dr. Madhu?
Yes. Cortisol has become the internet sweetheart for the be-all, blame-all hormone. So everyone wants their cortisol checked. I've gained weight. I'm exhausted. My body's in stress. I want my cortisol checked. Cortisol, for you to have, there are illnesses, very serious illnesses, where cortisol is a huge and important player. But those illnesses have such distinct and such profound symptoms that you couldn't miss them, and you would check the person's cortisol and investigate them further along. But cortisol is a hormone. It's in us, and it changes again throughout the day. It changes based on our sleep, based on our stress, based on what we're doing throughout the day, your exercise intake, your dietary intake, your caffeine intake, all these things. So when people are talking about, I want to get my cortisol level checked, it depends when you check it. Mild little variations don't mean anything, but it also creates a lot of stress in people. So if you are tired and if you are just feeling burnt out, it's not from the cortisol, it's from your life. Seriously.
It's very
Generally
true,
speaking.
right?
And it happens to all of us. Like, I don't
Yeah.
know anyone who doesn't feel tired and burnt out at times. We all do. I know I do for sure. And then I have to step back and reevaluate, why am I feeling this way? What responsibility do I take, and how can I fix my environment at this time to mitigate my stress and sleepless nights? So that is the one thing. So I would urge everyone again, and I've been saying this about the other 2 myths I've said, you have to discuss your symptoms. Your doctor has to take a good history to figure out what exactly is going on, and then you do the appropriate testing. So cortisol is a diagnostic tool, but it is not a wellness screen. This is not a screen where we check it to see how you're doing. No. If you have a problem and the red flags are going on, okay, this could be a serious thing, your doctor will check your cortisol amongst many other things. So cortisol alone, not a wellness screen.
I've seen in the internet something called adrenal fatigue. Is that like the
I think
same
that's what it
thing?
is. I think
Like
you're right.
they're wanting the
Yeah.
cortisol checked,
Yeah.
right?
Yeah. I call it life fatigue. I'm just
Oh,
tired.
we really live in this really high stress world. We have tons of things going on at the same time. We try to be super women and
Yeah.
do it all, but you can't.
And also with the screen time, I think that's a huge thing at nighttime. Like, I know I am guilty of that at times.
Yeah.
And I do think that I know that affects your sleep. So this is all on us too. We have to take some ownership.
Yeah. Back to a cancer question. So some people have said that, why do I have to get why do I have to get tested for lung cancer? I'm not a smoker. I don't vape. I don't smoke. I don't, do any of that stuff.
I'm glad you asked this question, Roop. It's a very common myth among the lay public, and I think most people, that lung cancer only occurs in smokers.
Yeah.
In reality, lung cancer in non-smoking individuals accounts for 15 to 20% of all lung cancer diagnoses worldwide. That's a large chunk. And if you considered it as a distinct entity just by itself,
Yeah.
lung cancer in non-smokers, it would be the 7th leading cause of cancer globally.
Wow.
The proportion of never smokers among lung cancer patients has increased over time. There was a study done in the US that reported in the 1990s the rate was about 8%. And 20 years later, in the 2010s, it was more like 15%. So that's like a larger and larger chunk because fewer people are smoking, which is great. And that means a larger chunk are never smokers. And there's because of this misperception that lung cancer is always smoking related, it can delay people from getting diagnosed or assessed by their family doctors. And studies have also shown that there's a significant stigma associated with lung cancer, which makes it, when the general population or the general public sees someone get lung cancer, they automatically think it's tobacco related. And that causes patients to experience feelings of guilt and blame. And that kind of stigmatizes anyone from getting testing done. Now, you might ask, well, why are the never smokers getting lung cancer? There are a lot of theories, and the most common risk factors are secondhand smoke, air pollution, radon exposure, which is a it's colorless, odorless gas occurring naturally in the environment. There's things like asbestos, which I think many people are aware of.
Yeah.
Some people have a family history of lung cancer, and certain people with chronic lung conditions are also at risk. I think we need a greater awareness of these other risk factors beyond tobacco to destigmatize lung cancer and for people to seek help with symptoms if they develop concerning symptoms associated with their breathing, coughing, blood in their sputum, to seek medical care, even if they don't smoke.
Yeah.
Yeah, because I was in Delhi in November, and I'm telling you, the pollution there, like I could see how someone could get lung cancer. It was horrific.
You got to wonder what their lung cancer rates are in New Delhi,
If
right?
they're tabulated properly.
I'm pretty sure in major metropolitan areas with poor exhaust fume air, they
Yeah.
are higher.
Yeah.
Dr. Madhu, another myth that we hear is that when people feel well, they don't think they have a need to check their blood pressure. They must be fine.
Very common myth. And so everyone calls blood pressure in the medical community a silent killer because we don't know the symptoms. We don't really feel the symptoms. So a lot of people will come to me, I'm having a headache, I feel pressure. And sometimes it could be stress, it could be a sinus headache, it could be muscle tension headache, and their blood pressure is fine. A lot of people will come in and they're like, I'm fine. I don't feel anything. And we'll check their blood pressure and I'll say, no, your blood pressure is high, but I don't feel anything. Well, that is the common thing. You don't feel anything. Now, the need to treat blood pressure is so essential because we don't want your blood pressure to keep going high. It causes so many other problems like strokes, heart failure, so many things. So we want to make sure that your blood pressure is normal. And I would say the vast majority of people are not going to feel symptoms. Now, if you feel symptoms and your blood pressure is high, that honestly is a medical emergency. If it's really shooting high, your blood pressure is super high, that can cause the headaches, chest pain, shortness of breath, or even visual changes. And I have seen that before, but it's very rare. It's treated in emergency at the time because the person is having such symptoms. But honestly, feeling fine does not mean your blood pressure is fine. So please, if you have a positive family history, and as South Asians, we are at a higher risk of getting high blood pressure, please get your blood pressure checked regularly. Also, as we age, our blood pressure does tend to go up as well, or can. So hypertension doesn't announce itself. The cuff will tell you the truth.
And so, some pharmacies actually have the blood pressure cuff right in the pharmacy. Is that the same level of measure as if you take
If
with the
it's a good
doctor?
machine, it should be, but I'll add one more caveat. So what I do, because a lot of my patients, It's hard to accept to take a medication chronically and they don't want to take it. And I respect that. So I will do a 24-hour ambulatory blood pressure where a cuff is put on them and every 30 minutes is checking their blood pressure for 24 hours. Some people might have white coat hypertension. They come in and they get stressed out at the doctor's office. So I encourage the 24-hour ambulatory blood pressure to confirm or do your own readings at home.
Fantastic.
Yeah, but it is a silent killer, so please don't dupe yourself into thinking that if you're feeling fine, your blood pressure is
So
fine.
this is one of the things that you should go to your doctor and ask for the blood pressure test, right? As opposed to all the hormones.
And very important, even more important if you have a positive family history, because I would say most people, if it's in your family, eventually it'll catch up to you.
And by the time you get symptoms, you've already caused organ damage in most cases.
Yes, thank you for mentioning that. That is actually very true. So we want to avoid your organs getting damaged.
Okay. Dr. Jiti, we have seen a high level of people using non-medical doctors for advice and medications. Are natural treatments safer than prescription medications?
Rup, I'm going to tackle that question as it relates to cancer because I see this and I get asked this very frequently by many patients. And the thing about natural treatments is that a lot of people don't understand is that when you use those instead of proven cancer therapies, it's associated with significantly worse survival outcomes. Patients, particularly patients who use alternative medicine as their sole cancer treatment, are at a higher risk of death by 2.5 times compared to those who use conventional therapies. And in certain cancers, it's even the magnitude is even higher. So for breast cancer, for instance, it's 6 times higher risk of death if you use alternative natural medicine instead of using conventional therapies, or in colorectal cancer, 5 times increased risk of death. The critical issue with these natural remedies is not that they're toxic in and of themselves, but they're harmful because they're ineffective in treating cancer, and also it often delays or replaces conventional treatment. And the other point I want to make is it's also important to distinguish between complementary medicine and alternative medicine. So complementary medicine usually is done in addition to conventional cancer therapies to help manage symptoms. For example, acupuncture to treat pain, or massage for anxiety, or yoga for fatigue. Those are all fine. And I actually say, sure, those are good things to do, or meditation to lower your stress levels. Those are all great things to do in addition to conventional therapy. Where we run into problems is when people use alternative medicine in place of proven cancer therapies. And those treatments lack evidence for treating the cancer itself and are associated with significantly worse survival outcomes. Natural does not mean safe. And I think people commonly think, oh, well, if it's natural, it must be safe. But many of these herbal products, these supplements, they can actually interact with chemotherapy drugs, and they can affect how well they work, and they can also make the side effects worse as well. And that's where we run into problems. The other thing is that the evidence base for using these treatments is completely different. So for conventional cancer therapies that we use, they have to go through rigorous testing through many phases of clinical trials to prove that they're not only effective, but they're safe to give patients. And that doesn't exist for natural therapies. In fact, most natural therapies are based on lab studies that are done in preclinical models or in animal studies, and that rarely ever translates to a benefit in humans. And there's no natural treatment that effectively treats cancer. What I tell my patients is, yes, some of the things we use now in our cancer therapies may have started naturally. It might be a plant, but that active ingredient in the plant has been purified and it's been tested to make sure it doesn't have any other adverse effects before we use it in patients. And if there was something out there that was effective, we would recommend it. Why would we want to spend thousands and thousands of dollars on chemotherapies if we could use a natural substance. So I don't mind complementary therapies. Alternative medicines, I would encourage you, if you are still going to use them, please talk to your doctor and let them know that you're planning to do this so they can work with you and see what can safely be given along with your proven treatments.
Yeah.
Dr. Jiti, that is like so important. I'm glad you said it. And Dr. Madhu, I'm going to turn this over to you because I know of women in their older years who are being treated, let's just say for blood pressure or hypertension, and they'll say, Flanna di pen, oh, aa khandi hai, India to mangaya, and it's been helping her.
I'm so glad you brought this up because Dr. Jiti spoke so eloquently, and I was like, I should just leave it there. But thank you for bringing that up because I do see this. And I've had 2 patients that I can recall right now that had lead poisoning. And we had to refer them to get the lead removed from their blood. That's quite an ordeal. Other patients, they don't know what's in it. And some patients have had steroids in it. So they come back with that moon face and you don't know what's in it. So I would rather have something I know what's in it. They don't know what's in it. It can be very detrimental to your health.
And a lot of these natural products aren't well regulated. So just because it says it has, I don't know, vitamin C in it or
Whatever.
turmeric in it, nobody's regulating.
And no one even knows. Eko pata nahi kuch paya hoya bas.
Even here, even the ones that we buy in pharmacies,
Yeah.
the natural remedies we buy, it's not well regulated. It's not like what goes through conventional
trials and
therapies and prescription medicine.
Health Canada is very rigorous. Before it's approved, it's been studied.
Yeah. We are lucky though to live in a country like Canada where these things are tested and where our healthcare are testing whether you need to get your hormones tested or your cortisol tested or to get a mammogram or to get a cervical cancer screening. That is free. So let's use it but not abuse it. Those would be my sort of closing remarks on this. Dr. Jiti, do you have anything to add?
No, I agree with you completely. We're very fortunate to live in Canada and to have guidelines in place that provide us with the best evidence-based recommendations for screening, for testing, for the regulation of medicines and prescriptions. I think we're very fortunate, and we have to be sure that when we're on the internet that we're not being bombarded with all these websites that give claims of things that work just because the person who's purporting those is actually making money off of them. And not because they're thinking of your benefit.
Yeah.
Dr. Madhu, closing remarks?
I think that when you have concerns, it's really important to share a history with your physician and then decide what really needs to be tested. And don't just fall for those, the honeys of the internet, cortisol, testosterone, and hormone testing. That's all I'd love to say. But if you need to be tested, your history will tell you so.
Thank you both so much. This has been an episode on Avaaz Health about myth busting, things we've heard on our social media and questions we've had when we're out in the field. And so we hope you've learned something here. If you have any more questions, comments, suggestions for future episodes, please reach out to us. We are on all the social media channels at Avaaz Health, and we look forward to hearing from you. Thanks for listening in. The information in this podcast is not a substitute for professional medical advice, diagnosis, or treatment.